Sotomayor, Brett Michaels, Mary Tyler Moore, Jay Cutler, and Nick Jonas all have type 1 diabetes, and so do I. These people are figures of today and tomorrow, and they all have T1D. Being diagnosed with this condition can be heartbreaking, and these celebrities went through it all and more. There are many types of diabetes, and I'll name a few. Type 1 diabetes is first, type 2 diabetes is another, and there's also gestational diabetes, and LDA, Latin autoimmune diabetes in adults, pancreatic diabetes, and finally renal diabetes. Type 1 diabetes happens when T cells mistakenly start attacking the beta cells, which live in the pancreas, produced insulin, needed to control blood sugar levels. The way this happens can depend on genes or a cold climate. Blood sugar, also known as blood glucose, provides nutrients to the muscles and organs. Glucose is made when you eat carbohydrates. The pancreas is an organ that holds beta cells to produce insulin, and the pancreas releases it when carbohydrates enter the body. Type 2 diabetes happens when the body creates insulin just fine, but it doesn't know how to use it. Like a toddler trying to build a car. They're not going to do it. It's impossible. Unless you spend 10 years teaching. But they're not a toddler. Some cases for this are obesity, smoking, and not much physical activity. Gestational diabetes is a form of diabetes that happens when you're pregnant, causing high blood glucose levels. It is normally diagnosed between 24 and 28 weeks of pregnancy, but can occur earlier in a rare case. LADA is a rare form of diabetes and occurs in adults older than 30 years of age. It takes a while to start affecting the person, which sometimes means getting misdiagnosed with type 2. At the beginning, they use diets, meds, and exercise like type 2, but then the pancreas stops making insulin, like T1D. Pancreatic diabetes happens by chronic pancreatitis, a very long inflammation of the pancreas, causing extensive damage to exocrine tissue. Hence the inflammation, and the pancreas cannot produce insulin. Brittle diabetes is another rare case of diabetes and is similar to T1D, but it has frequent DKA episodes, which I'll explain later. This flimsy stabilization often leads to hospitalization and an insulin pump with a continuous glucose monitor, and in rare cases, a pancreas transplant. In all cases of diabetes, people need tools and medications to help manage it. One of the most important tools is the blood glucose monitoring device, also known as a glucometer. The device lets you see your blood glucose number. There's also a lancing device that goes along with the glucometer. The way it works is you prick your finger with the lancet, which makes it bleed. Then you use a test strip that has a hole for the blood and stick it into the meter. Next, you put the bloody finger onto the strip to test the glucose in your blood, and then it transmits the number of glucose in your blood to the screen of the meter. Another important tool is the insulin pen. The insulin pen is a way to get insulin into your body without the need of a pancreas. This device looks like an EpiPen, but it's not just one use, and it's smaller. Use micro needles that are very thin and sometimes very short. There's a cap on one end with a spot for a needle. On the other end, there's a dial that you use to pick how much insulin you need to cover your carbs. Before you use the pen help, you have to waste 2 units out of it. Also known as priming. Big waste, I know, right? To get the needle on the pen, you turn it until you hear a click. Then you take the cap off. Before you inject the insulin, you must clean the injection site with an alcohol swab. Then you put the needle on and turn and take the cap off. Then you turn the dial to wait 2 units. After that, you actually dial the amount of insulin that you will finally inject. Finally, you inject the desired amount of insulin into your body. Pricking your finger can be time-consuming and can make scars on your fingers. This is where other forms of checking the glucose come in. There are 2 different types of monitors: the fast glucose monitor and the continuous glucose monitor. You must insert a reader into your skin to transmit a number to either a scanner or a receiver, or a phone. The two big companies that are in the business are Dexcom, the continuous glucose monitor, or Abbott, the fast glucose monitor. The fast glucose monitor requires a scanner that you use to check your glucose number. The continuous glucose monitor constantly streams the number to the receiver, or in a Dexcom's case, an iPhone. The Freestyle Libre is the most recent model for Abbott, and the G6 is the most recent model for Dexcom. The Libre can last 14 days, while the Dexcom lasts for 10, but sometimes less. The Dexcom line of products are more popular with the younger age group because it can let you share your number with multiple people. Say if little Tommy is playing outside with his friends, and he can't check his number. His mother or father can look at their iPhones and see his number. The Libre doesn't have this feature, but it's much smaller and less painful. At the beginning of this TED talk, you might remember that I mentioned something called DKA, or diabetic ketoacidosis. DKA happens usually when you aren't diagnosed with diabetes yet. When you're in DKA, you have more ketones in your blood. This many ketones in your blood results in your blood becoming acidic. Hence the acidosis. Being in DKA results in needing to be hospitalized. To get out of DKA, you need potassium, insulin, and IV fluids. Some early symptoms of DKA include very high blood glucose levels, frequent urination, and dehydration. Some advanced symptoms are a fruity smell in the breath, vomiting, nausea, or stomach pains, and disorientation. Ketones happen when the body doesn't have enough insulin to digest the food in the body, so it starts burning fat. Ketones can be very bad for you and need to be flushed out with ice water, preferably with a straw. This helps because the water flushes out the ketones from your blood. The ice is self-explanatory, but the straw helps keep the water cold in your mouth. People with diabetes need to wait to see what their average blood glucose levels are. This is what an A1C, or as it stands for, glycated hemoglobin, is for. An A1C is a form that gives a number going by 0.5. An A1C measures your average blood glucose levels for the past 3 months. It provides a bigger picture for you and to help manage your diabetes. The American Diabetes Association suggests that an average A1C of below 7%. The A1C is also used to diagnose type 1 and type 2 diabetes. Everyday diabetics find A1C useful, but the main use is for doctors. Doctors can see how your glucose numbers have been with the A1C. A1C numbers are shown on sheets that are given to you by per doctor appointment. So far, there is no cure for type 1 diabetes. Finding a cure is on high priority for diabetes researchers. There are many different approaches, and I'll name a few. One approach is the beta cell replacement. Beta cell replacement has been under research for a long time, originally using insulin-producing cells from donors. However, this treatment has some problems. The T cells that attack the other beta cells will now attack the transplanted beta cells, meaning that the patient must go on lifelong immunosuppression, which means that the body rejects the treatment or medication. A recent study at the University of Copenhagen, Denmark, has discovered that when certain proteins are exposed in the extracellular matrix, they guide the protogeners to their fate. The protogeners are a type of cell that changes more it moves around in the pancreas. These cells can turn into many different types of cells, and one of them being a beta cell. This study helped the cure approach of turning stem cells into insulin-producing cells. With all this information, I hope you will spread awareness of this emotionally and physically painful disease.